It's not unknown, it's rare, but it's sometimes therapists are registered with their professional body and then they let the membership lapse.
Okay.
Not been struck off necessarily, that's unusual, but just to let it lapse, so maybe they're not getting the supervision, they're not up to date, but their website still has the number. So it's worthwhile contacting the organisation to check they're still on the register. Both those big organisations, you can check the registration online,
Okay.
but you just want to make sure. So the number per se is a good sign, but you just want to make sure the registration is live.
Okay.
The other thing, because it's possible to be a therapist without being a member of those two bodies, I would not recommend seeing anyone who wasn't part of a professional body, is to make sure they're insured, right? Not because you anticipate making a claim, but insurers have very clear rules about who they're prepared to insure. So if you, for whatever reason, maybe word of mouth, are told that a certain person is a counsellor and they're quite good, and you go to their website or you ask them, are you registered with a professional body? And they say no. Then the next question is, are you insured and who are you insured with, and can I see your insurance certificate?
Okay.
Again, not because you're worried about, I'm going to make a claim against them, but it's just because if they're not insured and they're not a member of a professional body, then you really do have other choices. You need to be very, very clear about that.
Because there's also ethical standards and
Of
professional
course,
standards,
absolutely,
and as you
yes,
said, somebody
yeah.
could just call themselves a therapist,
Yes,
put up a website, and
Mhm.
and you want to know that they've had a certain level of training, that they're being supervised, etc.
Absolutely, absolutely. If you're registered with a professional body and you're maintaining your registration, as you say, that means that you have to do a certain number of hours of continuing professional development, or CPD. It means that you've got to be getting regular supervision from a more experienced counsellor or therapist. It means that you will have, as a therapist, access to the latest advice from the NHS or the National Institute of Clinical Excellence, or the American versions of that. They'll just be more up to date. And also it means that you have to stick by certain rules, for example, in terms of GDPR and privacy and data management. So it means you can be confident that your data is being processed in a confidential way. This is not a necessary thing, but I often recommend to people looking for therapists to check whether the private practice is registered with the ICO, the
Information Commissioner's Office.
Correct, exactly. Again, it's just one of those symptoms of someone running a professional practice, alert to their professional responsibilities, and takes good practice as being something that makes them a better therapist and not just a burden on the paperwork. That's important. One aspect which is becoming more frequent now because of the high demand for mental health services, and it's offered through some charitable practices, is they make you an offer of saying, we have a waiting list of maybe 4 weeks, or maybe in the NHS we have a waiting list of 3 to 6 months. What we can give you just now is that you join a group.
Right.
You can come along, roll on, roll off group often, maybe once a week for an hour. There might be 10, 12 people in the room, and you would have, and a therapist obviously, and you would have a chance to share some of the issues and challenges that you're facing, and they would give some feedback and invite other members in. Has anyone else had this experience? Is there anything you'd like to say to John? So they will moderate that. They will make sure that no poor advice is being given. The idea, of course, is to give people access to some sort of support while they're waiting for that one-to-one support.
Okay.
As for effectiveness, it's probably not a lot of research on it, but probably I think it's on balance a good option for people to have. You shouldn't feel that you have to go along to it. It won't diminish the quality of care you will get when you do have the one-to-one sessions. It's not going to bump you up the waiting list, not going to bump you down the waiting list. It's an option. My general advice would be to go along to one session, see what you think of it. If you don't like it or it's not for you, that's fine. You don't have to go back. But it's worth giving it a try. More and more trusts and charitable mental health services are offering group options, principally as a way of bridging the gap between initial referral and you getting your one-to-one session.
And one other thing that I've also noticed cropping up more and more is online therapy.
Oh yeah.
And again, the same things that we've talked about for charitable therapy and for private therapy, it's worth checking out.
Yeah.
So have a look at their website, look for membership number. If they're a charity, are they a registered charity?
Yes.
Who they're registered with?
Mhm.
And again, it's signs that they're a professional, ethical body that takes training seriously,
Sure.
supervision, that the people have reached a certain level of standard.
Absolutely. The online services are very interesting. Often they are offered by private counselling services in addition to their normal one-to-one service, sometimes because they're offering specialist services and there are not a lot of options locally. They'll use Skype, video conferencing, and there's a bit of an issue about Skype. I wouldn't want to worry anyone, but it looks as though Skype doesn't have the same sort of level of industrial internet security as some. Now I know they're improving it, but there has been some work on that, whereas Zoom is seen to be a much more secure platform. I wouldn't worry unduly about that, but it's a good sign of how alert the counselling service is to data protection issues. So if you use Zoom rather than Skype and say because we think it's more secure, then they know what they're doing.
And actually their answer to a lot of the questions that we've asked for, saying things like, can we see your certification, can we see your registered membership number? You can often tell a lot by someone by their willingness to engage with that, because most professional organisations will go, yes, here's these policies, here's these standards, here's all the information you need. If people start to get very evasive, then that can be a warning sign.
Absolutely, and it's not, but you might be asking for 9 or 10 different bits of information, but a professional private practice know that people want to have that information. They'll have it already. They're just, they're not looking about for it in boxes. It's ready. It's good to go. So, engaging with mental health services involves a lot of decision making, a lot of choices. Not all options are open to everyone because you may not have the means to access certain types of private therapy. Geographically, certain parts of the country don't offer more specialist services, even in the private domain. Time is a factor. You might feel as though you've waited long enough, you want to get on with it. There are many choices to be concerned about, to bear in mind and to think about. But as I say, I think the first point of departure is to speak to the GP, because even if the GP is not able to recommend a specific talking therapy for you apart from the NHS, it's good to keep checking in with the GP in terms of your progress, the medication options there, and it's good also for if you do see a therapist or a counsellor in a charitable or private setting, one of the first things they will ask you is, when did you last see a GP? Are you on any medication? And if you haven't been to see a GP about, say, depression ever, and you've been at a therapist, they will say, well, don't you think it would be a good idea to go and check in with your GP? So you might as well do it that way.
Do it first.
Really, yeah, absolutely.
So we were chatting a bit about CBT, and for a lot of people who go to the GP, the NHS is providing what's called IAPT. Do you want to tell us a bit about IAPT and kind of what it is?
Yeah, sure. IAPT, which stands for Improving Access to Psychological Therapies, was brought in about 10 years or so ago in different forms to try and improve access to psychological therapies that are evidence-based. So it's a kind of shortened version of full CBT. Okay. So instead of 12 sessions that you might get with a private therapist or in a charitable organisation, you'll probably get about 6 sessions, and there are the therapists running these sessions will be well trained and well versed in the systems of psychotherapy. They'll have a handbook which they'll kind of use to make sure they keep things on track. But 6 sessions is a short period of time. Some clients take a little bit of time to develop a rapport with a therapist for whatever reason, and so maybe it's only the 2nd or 3rd session where you're actually getting into any substantive work. It does mean that if there's a plan about trying to improve things, you can barely schedule anything that's going to last a month because you will have finished almost by that time. And of course you need the final session just to kind of wrap things up. So it is definitely better than having nothing at all.
Yeah.
It's not going to be effective for complex, enduring problems where maybe depression and anxiety are an issue. But if you're suffering from depression and you've not tried anything else, or for general anxiety, it can be beneficial, and the research shows that for some people it can be beneficial.
And it's certainly better than nothing.
It's better than nothing, and you get it on the NHS,
Yeah.
and it's something which, at the very least, opens your eyes to the possibilities of therapy. So what some people do is have IAP and then move on to private counselling, but the waiting time for IAP now is still quite long, and so people want something before they do that. So it's good that it's there, but it's not ideal for everyone, particularly for complex and enduring challenges.
And I suppose one of the things we didn't talk about private counselling is the actual price.
Yes,
and I'm sure it varies
It does.
a lot around, but just sort of give people an idea of what sort of levels they might be paying.
Yeah. Like most things, the prices will vary enormously depending upon geographical location. So London and big cities, the price is higher. The more experienced the counsellor, better qualified the counsellor is, the more the charge would normally be. But looking around generally, outside of London, you would find a qualified therapist for as little as £30 an hour.
Okay.
Going up to the majority of counsellors, therapists would be charging about £60 to £70 an hour, and then you have some who are charging between £80 and £95 an hour, and then probably in London you would be looking at £110 to £130 per hour for a very experienced therapist. So they do vary enormously. Price is not necessarily an index of quality. The best therapist in the world is no good if it's not the right therapist for you. In terms of managing the finances, most therapists would say that you can pay for one initial session and decide whether you want to go ahead. A small number offer a free initial consultation, maybe only half an hour, but it is free. Some therapists will offer you the opportunity to pay for 4 or 5 sessions in advance and offer you a discount. That's okay, but you do not want to be committing yourself to something until you really know what you're committing yourself to. And you don't want to be going to your therapy because you're saying, well, I've paid for it, I should go. You should be motivated to go because you feel as though you're getting something out of it. Yeah. Check the contract, it should specify the charge, and of course make sure that you understand what the cancellation fee is, if any. Normally you can alter an appointment up until 2 days beforehand, but after that point you are normally required to pay the full fee.
And it's probably worth saying is it's not something that occurs very often, but I've certainly encountered it quite a lot where one person pays for another person's therapy.
Yes.
So it may be that if you're the carer or you're a family member, that you pay for your loved one's therapy. But it's worth reiterating that the therapeutic contract is between the therapist, the counsellor, and the client, not you. So even though you're paying, some people say, oh, well, I'm paying, so, can I have updates? Can you let me know how they're doing? It's like the therapist and the counsellor will basically not really be able to give you any information whatsoever because their therapeutic contract is with the client.
That's
so
right.
I don't know if you've encountered any issues around that.
Yes, very often young people have their fee paid by their mum or dad.
Okay.
And that's absolutely fine. The way I've always done it is if the parent has any questions about my approach to therapy and how often the sessions would be and how many sessions, parents often want to know, well, how many sessions is it likely to need? So before I've met the individual, if they ask me those questions, I'm happy to tell them everything and send them links and stuff. But as soon as I see that person and they sign the contract, that's it. The fact that you're paying for some of the therapy gives you no rights whatsoever about the content of that therapy, whether the therapy is even continuing. One of the things I do raise with my clients if they're not paying for it early on is to say, well, if you miss a session or you phone me up and say you really don't feel like having a session, and you do that too late for me to do anything other than charge you the fee anyway. Are you happy that I tell the person paying that they're paying for a session you didn't come to, or would you rather that I didn't say anything at all? Because I make it clear to the person paying that they're paying all the fees that are required to be paid. If I send them an invoice, that's what it means. A fee is required to be paid. It doesn't tell them anything about whether the person turned up. It doesn't tell them anything about, obviously, whether that session contained any information about them, of course. Where things can get potentially complicated is when, as I would recommend, a carer goes along to one of the sessions with the permission of the therapist, with the permission of the client, because they want to be able to help to understand what the direction of support is, what the direction of the journey of recovery might be, so they can play their part. There might be one or two questions in that session about the relationship, one or two questions about whether or not the carer has had any mental health issues in the past. The therapist would just maybe like to know that, to understand what your orientation is to these difficulties. And you know, that would be fine. If that conversation takes place in a therapeutic session, of course, it doesn't mean in any way, shape or form that you have become a client too.
Yeah.
You were there as a guest. And if the conversation in the confidential therapy session subsequently revisit those issues, you will not be informed about that. Your partner, the client, will not be required in any way, shape or form to tell you about that. It's not going to be a big issue. It's just worth bearing in mind that if you go along to one of the sessions to participate, to help, you are still not a client. Of course, in some circumstances, the therapist might say, actually, I think this is something which maybe needs to be a couples therapy rather than individual, and then you need to recontract around that so everyone knows exactly where they stand.
And I think that's a really good point, and it may well be that the person you're caring for wants to share some of the information. In fact, as you said, if they've got exercise and so on, it's incredibly valuable. Yeah. So I think being open to it is really valuable, but equally recognising that there are limits to confidentiality, and just to respect that. And sometimes the way you can phrase that, so did anything helpful come out of the session? Is there anything that I can help support you with? That feels much less like prying and much more like, how can I support you in this process? I hope you found this course helpful. At FCC, we're committed to providing courses and training for unpaid carers, and these courses are completely free. If you found this helpful, you could support our work in 3 ways. Please recommend it to any friends or people that you know that will benefit from the courses. Please consider sharing it on social media. And if you can, please consider donating. There are buttons on the website where you can donate £1, £2, £5, and every pound that you donate will make a huge difference by helping us make more and more care courses completely free to carers. Thank you very much.